Thank you for your interest in SmartVEMP, the innovative CVEMP and OVEMP solution you've been waiting for. The most advanced VEMP module in the market has been enhanced to become the ideal tool for vestibular evoked myogenic potentials. The SmartVEMP module is the only device cleared by the FDA for CVEMP and OVEMP testing on patients of all ages. SmartVEMP includes the ability to monitor EMG activity using the same recording electrode. There is no need for additional EMG monitoring electrodes. SmartVEMP includes a user-friendly interface to easily select the target EMG levels for each patient. The window automatically calculates the acceptance range for each patient based on the clinician selections, and the system will only average sweeps with adequate EMG activity. SmartVEMP provides various patient-friendly options for visual biofeedback. First, the feedback box with LED indicators, with the green LED turning on when the EMG activity is adequate, and the orange lights turning on when the EMG activity is too low or too high. We also have the on-screen EMG level display with a happy and sad face. Happy face, of course, when the EMG activity is adequate, and the sad face when it is not. For pediatric testing, we're happy to include an option for animated videos, which play when the EMG activity is adequate and pause when it is not. As a part of SmartEP, SmartVEMP includes easy-to-mark peak labels using the mouse or keyboard. Baseline is automatically marked to the user-defined acceptance region. You can quickly calculate a grand average using multiple recordings. Once the labels are marked, the system will calculate the P1 amplitude, as well as the corrected P1 amplitudes, based on the pre-stimulus EMG levels. Our comparison feature will also calculate the asymmetry ratio after you select the left and right recordings. Here, you will see a sample cervical VEMP recording for the left and right ears, with the asymmetry ratio displayed at the center of the page. Here, you will see a sample OVEMP recording for the left and right ears, with the asymmetry ratio displayed at the center of the page. I will give you a brief tour of how easy it is to record CVEMPs using SmartVEMP with our preset protocols. Once the patient demographics are entered and our patient is prepped, the CVEMP parameter file can be loaded from the SmartEP control panel found at the bottom of the screen. Once the patient has activated the left SCM muscle, I will click on Acquire to begin acquisition. To select a waveform, you can click on the waveform on the circle on the left of the waveform. Once a waveform is selected, you can move it up and down the screen by dragging it or by using the up and down arrows on the keyboard. During acquisition, the number of sweeps will appear on the top left with the number of rejections next to it. You can label the peaks at any time during or after acquisition, and even work on one waveform while acquiring another. In this case, I will wait until I have the average 3 sets of recordings for each ear, and will label the average recording. We prefer to record 3 recordings of 50 sweeps at least, with a 15-second rest in between to avoid muscle fatigue. Once I finish recording 3 runs of 50 sweeps for the left ear, I will record 3 runs for the other ear. The I, O, and R buttons on the top allow you to quickly arrange recordings by intensity, order of acquisition, or rate. I'll use the O shortcut to separate the recordings by order of acquisition so that I can easily select the 3 recordings and calculate the average. To calculate an average, I hold down the Control key and select 3 recordings. Then I go to Process, Add Selected. The average recordings will be bolded and I can separate it from the rest of the recordings so that it is more visible. I will do the same for the right ear, this time using one of the keyboard shortcuts, the plus key. To mark the peaks, first make sure the waveform you're trying to label is selected. Selected waveforms are green in color. Click on the label for the peak you're trying to mark, then click right above or below the waveform where you'd like to place it. Once the peak labeled is placed, you will notice there are 2 triangles, one at the top facing down and the other at the bottom facing up. The top marker is the latency marker and the bottom marker is the amplitude marker. You can adjust the position of either marker either by clicking and dragging the marker or using the keyboard. To move the latency marker, use the right and left arrow keys, and to move the amplitude marker, use the right or left arrow keys while holding down the Alt key. Once I labeled P1, I move the amplitude marker to N1 so that the P1 amplitude can be calculated. Once I have labeled the recordings, I will select them both. Then from the Embedded Recording Information panel, I can navigate to the Comparison tab to find the P1 and corrected P1 amplitudes, as well as the asymmetry ratio automatically calculated by the system. These values can be added to the report pretty easily. And this report I can save to review later, save as a PDF, or print. Thank you for taking the time to learn about SmartVEMP. Please feel free to contact us if you have any questions, need additional information, or would like to schedule a demonstration.